Y'all know me, I'm Dr. B, and this is The Buzz on hand, foot, mouth disease. Hand, foot, mouth disease is a very common disease. Just about everyone gets this at some point in their lives, although sometimes the signs can be very subtle and it may go unnoticed. Usually we see this in the summer, and it usually starts with a fever, followed by a sore throat and the development of some sores in the mouth. The lesions in the throat look like this. They're kind of whitish gray ulcers. You can see one big one there right in the middle. And they're surrounded by red around the edges. They're located way in the back of the throat, so they may be kind of hard to see at home. So when we get the child to the office, we're going to open up their throat with a little tongue depressor, have them say, ah, all that stuff. And then you'll really be able to see what we're talking about. You can see that little thing that hangs down right in the middle of the throat, the uvula. Above that, you have some grayish, gray looking ulcers. There's ones on the left and the right. And as you get closer towards the front of the mouth, they get less numerous and they get kind of smaller, and then they kind of fade out as you get close to the front of the mouth. So this is something that you're going to see way in the back of the throat. It causes a sore throat. The kids generally don't want to eat very well. Sometimes it's a little bit difficult to tell if a child has a sore throat, especially in someone who doesn't speak yet. So, like I said, they may just not want to eat, or they may drool more, or they may spit their food out. Classically, hand, foot, mouth also causes a rash on the hands and the feet and around the bum. So, really, it's hand, foot, mouth, and bum disease, is what we should call it. In this picture, there's a little rash around the mouth. So not only do you have those lesions in the back of the throat, but you also have them around the mouth, on the skin around the mouth. If you see lesions on the lips, involving the lips and inside the front of the mouth, it might be a different virus. It might be herpes or cold sores. But as you can see, this is not involving the lips very much at all, and it's actually down onto the chin. This is what the rash looks like on the hands, and this is very early on. You can see that the hands are pink. There's little pink spots all over the palms, and there's these, again, these like looks like fluid-filled areas or ulcers on the fingers themselves. This is very painful, and it looks like these things almost like they have fluid in them. These lesions are most obvious on the fingers and the palms, but they can go even up the lower arm to the elbow. After about 5 days, the child stops getting new lesions, and as they stick around, they start looking darker, like in this picture. You can see that they're a lot darker. That fluid-looking grayish spots are gone, and they're getting to be almost a darker maroon color. And as it ages even more, you can see that they're really dark, almost like bruises, and some of them may actually open up and have little erosions on the skin, kind of like at the base of the thumb, at the base of the hand there. Here's some spots on the feet. And again, they look pretty similar. These are very painful, and the child may not want to walk, and they may want to hobble around or be carried. These lesions can go up the feet, and they go up onto the lower legs, but we won't see them usually above the calf or above the knee. A little while later, as the child gets over that rash, you may see some peeling and what we call desquamation, which means the skin starts peeling off. This is especially evident on the toes, which can dry out and peel, but it can happen on the hands as well. Now, we say hand, foot, mouth, and bum, but hand, foot, mouth doesn't always cause rash in addition to the oral sores and the sores in the back of the throat. Sometimes it only causes sores in the throat, and in that case, we call the disease herpingina instead of hand, foot, mouth disease. But it's exactly the same disease caused by the same virus. By the way, herpingina does sound like herpes, but it is not. It's a completely different virus, and we will talk about herpes in the next lecture. So to summarize, this is a virus that causes 2 or 3 days of fever and sore throat, followed by a rash. You might see it around the mouth. You might see some of those sores in the back of the throat. You're going to see it on the palms and the soles, sometimes around the booty hole. It's painful, it's itchy, but after about 5 days, you stop getting lesions, and maybe a week after that, it should be gone. You may be left with some kind of faint spots for a few weeks, but it should be gone after about a week and a half, 2 weeks. This is an annoying, painful, itchy rash, annoying disease, but it's otherwise not harmful. Hand, foot, mouth disease is very contagious. It spreads through daycares like wildfire. It's passed by saliva and poop, and even the cleanest daycares with the best cleaning regimens, it will still spread like an epidemic. Kids who have this need to stay home until they're feeling better, maybe a week, week and a half. You really got to do this. Otherwise, everyone's going to get sick and everyone's going to be mad at you. So we don't want that. You can pass this virus for weeks. It can be detected in poop and saliva for weeks. However, after the lesions have all dried up and they're starting to fade and go away, it's probably safe to go back to daycare. There is no specific treatment for hand, foot, mouth disease because it's caused by a virus called Coxsackie virus. And if you watched episode 6, you learned that viruses typically we don't have very good therapies for them. If it's bacteria, we could probably put you on an antibiotic and make it better. As it is, you're just going to have to do symptomatic care, taking care of the symptoms, using some Tylenol or Motrin for pain or fever, making sure that the child is drinking plenty of fluids. The rash does not require any specific treatment, but it can get kind of itchy and it can be painful if they're walking around. So again, Tylenol, maybe Benadryl for itching if that's necessary. Moisturizing the skin because it'll probably dry out and may start peeling. And the final thing is, some doctors will use something called magic mouthwash. It's a combination of things to make the mouth numb so that when they try to drink, it doesn't hurt. If you're interested in that kind of thing, you need to talk to your doctor about what kind of magic mouthwash they prescribe in the office. To prevent this, since it's passed by saliva and poop, the most important thing is hand washing, of course. Keeping your child home if they're sick. Wait till the lesions start going away before you send them back to daycare. Make sure the daycare knows that your child has had hand, foot, mouth. It's not very common for kids to get this more than once. It can be caused by multiple strains, so sometimes kids do get it more than once, which means that even adults can get this, but it's not common. Usually you have a really bad outbreak early in life, and then as time goes on, you don't have the same kind of problem. The other thing that's important is sanitizing around the place where you're changing the diaper. Remember, this is from poop is a good way to get this. So sanitize the area where you're changing your baby and always change the baby in the same area so you know that that's the contaminated zone. That's where you need to be most careful. The only really dangerous thing about hand, foot, mouth is if the child doesn't want to drink and they get dehydrated. What you can do in that situation is try giving them a dose of Tylenol or acetaminophen. If you watch episode 23, you'll know what the dosing is. But give them some acetaminophen, see if that makes their throat feel better, and then maybe 20 minutes later, try to give them something cold to drink, and hopefully they'll take it in. If you think your child's getting dehydrated, you definitely need to see your doctor and make sure they don't need IV fluids. Well, that's all you need to know for hand, foot, mouth, and bum. Don't forget the bum part. Y'all know me, I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. We'll see you next time.